Okay, it's on.
Okay, let me check it over.
Daniel, are you out there?
Oh,
Have you met?
no, not yet.
This is Daniel, our medical student, and he's going to be videoing so that we can live stream it out in the lobbies, right? So he'll be following every step of the way here.
Okay.
And
Great.
Excellent.
and that's Annie, our other medical student, who will be helping out with any needs. Okay, so hopefully we're on. And I hope those of you out there in the lobbies can hear me, because obviously I can't hear myself. And so let's take his stuff, Jan. Come on up and stand up. We'll walk out there for a quick moment. And again, don't hesitate. If you need to grab my arm, please don't hesitate. It's nothing to be embarrassed about, but you are under the influence a little bit. 10 milligrams of Valium isn't really that much, but everyone's different. So. Let's go. All right, ladies and gentlemen. Oh. Okay, what's Beth, we need. Where's Beth? Beth, we need to get the streaming going. You know what to do? And then, so one of our staff on the other side make sure that the other screen is working. Annie will do it. Make sure the other screen is okay. Excuse us here. Excuse us. So, doing this ultra pulse laser, I don't know why they would want to know that.
Excuse me.
Yeah, but it doesn't connect to services. It's not like come on up here. Okay, so while we're getting the streaming going, ladies and gentlemen, let's introduce Mr. Harry here.
Hi.
And he's going to be our model for the eyelids, and you can see that he has quite a significant amount of this pudding, as I call it. And so we're going to take him back to the preoperative area, and I'm going to be drawing on him and our medical student Daniel. We have two wonderful medical students, Daniel to my right and Annie right here next to Beth. They're going to be assisting us in this. And so there is a delay, you know how like when you're doing satellite things and stuff, there's that delay. So right now, because I'm out here, I'm talking and then it's delayed here, but you won't know once I get back there because you really won't know what we're doing. So, any questions for Harry before we take him back? To start with, we'll bring him back out after the surgery, but I just wanted to see if you had any questions to start with. All right, thank you. All right, we're going to go back there, and Daniel will follow us. Yes. 20 minutes or so. All right. Okay, off we go, and we're going to go back here, Jen. And then we're going to draw him here in a moment.
Been around so many ladies.
Do you like monitors on during the procedure, sir?
All right. So I don't know who can run back and forth. If Annie can hear me, we need feedback back here in the surgery center. Or maybe Melissa, can you just run out there and see if Beth has gotten the streaming going? Because I'm going to be drawing on him. Pardon me 1 second. I'm just going to drop this down for a moment. Okay. Nice and steady there, Daniel. We're good? Excellent. Now the one thing that's a little different here today, and you guys won't appreciate it, but it's a little odd for me, is that we're used to, when I do surgery, we're used to having music playing in the background, and I'm usually humming or singing or doing what have you. But obviously our speakers are being used for my narration. So it's a bit odd because it's quiet back here. Other than me blabbing, it's quiet. And so that is one thing that's a bit unusual. Okay. All right, so we're going to draw on Daniel. We're going to start on this eye here. So he has quite a bit of hooding, so we're going to ask him to close his eyelids like he's sleeping, and so I'm going to mark out his eyelid crease. Hey, also, Melissa, or on my desk, you get my... So there's his eyelid crease in the right lid. There we go. Now you can do both together and close your eyes again. So here's the eyelid crease that we've marked out. You have them there? Team, come on, I need them. What are we doing?
There you go.
Thank you. Okay, so now we're gonna pinch the skin, because a lot of people ask me, well, how do you know how much skin to remove? Well, as you can see, I'm pinching all this skin, and then we're gonna determine about there. It's perfect. And we're going to do the rest. I'm going to turn you towards me here so I can see what I'm doing. That always helps. Now we always come out because, as you can see, out in this outer corner, universally, to a greater or lesser degree, there's always overhang of skin way out here. So the incision never ends right at the corner. It always comes out a little ways. So you can see when I stretch this out, that's the area that's going to be removed right there. And we're going to do the same thing on the other lid. We're going to pinch. Go, and hopefully you can all appreciate this out there, I hope. All right, now we're going to do one final check. I'm going to pinch here. Pinch here, looks beautiful. We're going to pinch here, beautiful. So there we have it. And then at this point we discharge the patient home. No, just teasing. Okay. So now we're going to get our wonderful nursing staff, Jan and Melissa, who's going to be my scrub tech. And here, let's take a little photo of Jan. Here, come on, ladies. This is our A team. Or here. Okay, so this is our A team. This is Jan. This is Melissa. Jan, I did her eyelids how many years ago?
2003.
Really? That long ago? Wow. Okay, so I did Jan's eyelids. Jan, this is again Jan. I did her eyelids 16 years ago. And Melissa, of course, she's too young because she's only 21. But Melissa's been here 16 plus years, and Jan is kind of a rookie. She's been here 7 years. So we got the rookie 7 years, 16 years. Okay, all right, so I'm gonna let them wheel Harry, and Daniel's gonna follow along. We're gonna wheel him to the operating room. We're gonna place him supine on his back. I'll be in there shortly, and then we'll go through the numbing process. Sound good?
Sounds good.
Perfect.
Right, Mr. Newman. You have to bend your knees and push yourself up to the top of the bed. You got about a foot and a half to go.
A little bit more.
A little bit more.
Okay, there you go.
Bend your knees again. Bend your knee, there you go. Perfect. All right. Tell us your first and last name.
My last name,
Your first and last name.
Jim Barnes,
Okay, yeah, all right.
Harry,
And your date of birth.
1647.
What you haven't done here today.
Eyelids,
And are you allergic to anything at all?
not so.
Perfect. Gel lined up.
Okay, I'm gonna start with some numbing eye drops for Dr. Justo. Fix those eyelids now. This first one's gonna be a little bit cold. It can sting a little bit. We're just gonna have you look
We're
down.
back on audio, I hope.
And look down again. Good.
And we're just putting some numbing drops in Harry's eyes.
And another one here. This one's gonna sting. Look down.
Okay. All right, so before we cleanse and drape around his face, I'm going to do the numbing. Now, before we do that, I got to also give a big shout out to my alma mater, for those of you out there who are familiar with the University of Michigan. And Daniel, if you can take a close-up of my surgery hat, right? So this is a University of Michigan surgical scrub cap that my staff gave me for Christmas. So it's now been added to my collection. And thank you very much, Daniel. Okay, so if I can get the numbing stuff. A bunch of 4x4s. Perfect. Okay, so we have a little concoction of a little lidocaine, tiny bit of epinephrine, and a little bit of sodium bicarbonate. And I'll probably have to tell you to keep that a secret, because that's our private concoction where we try and make this very, very comfortable for patients. It's a super, super tiny needle. It's just a, what is this, a 30? It's a 30 gauge needle, super, super tiny. And so we're gonna have Mr. Harry to just gently close his eyes, and then he'll feel a little bee sting here, and hopefully won't be much at all. There we go. And then we slowly inject. And is it okay if I call you Harry?
Sure.
I mean, I don't like calling patients by their first names, but if that's all right, we're all friends here.
Okay.
So you can see how the eyelid is kind of ballooning a little bit as I'm injecting that. And Harry, how's the sensation?
Oh, don't feel anything.
Doesn't feel anything, huh? That's our secret remedy. So I'm going to inject a little bit over here. And then we're going to inject a little bit over here. Okay, still doing okay there?
Yep.
Good. All right, so we have the left upper lid numb. You can see that it's more swollen than the right, and the swelling is just the fluid for the lidocaine being in there. So now we're going to go to the right upper lid. And again, little bee sting, Harry. And you can see how well tolerated it is because of our secret concoction that I should not have disclosed, so that no one takes my secrets. But you kind of learn these things over the years, because our goal, of course, is to make each patient as comfortable as possible. And just a little last touch out here in the corner. And so now you can see both lids together there. So we'll keep these in case we need them later. All right. So now we're going to basically turn Harry over. Let me just get him in good position there. And we're going to turn him over to Nurse Jan. Jan's going to use a little betadine to cleanse around his face, and then we'll put some little wet drapes around him before we start the procedures.
Going to wipe that off. So during the procedure, it's normal that you're going to feel pressure. But if you feel anything painful, speak up and we'll give you more numbing medicine, okay?
Okay.
I'm gonna have you lift your head up for me. All right, back down. You're gonna feel some cold towels here wrap around the sides of your face. Now you're gonna feel another cool towel that's gonna rest up on the top of your chin. Cover your eyes and we're going to shine some lights here on you.
Daniel, how's the reflection from the lights there? Can I turn it down?
Yeah, turn it down a little bit. It's better. That's good. Good. Thank you.
Okay, hopefully everyone out there can still hear me. I'm just gowning up here. The gloves. Jan, can you bring the bed up just slightly? Just a little bit. That's good, thanks. Okay. All right, so we're gonna get started. That was just all the preparatory stuff. And Harry, you doing okay under there?
Yeah, fine.
All right, perfect. So the first thing I like to I call it mark around the eyelids, and in reality what we're doing is we're using a little fine blade. Now, when I first started using the laser for my blepharoplasty, say, Jan, can you get just a touch more light, Jan? So I've been using the CO2 laser for, and a little bit on the other one. For about 23 years now. I mean, I've done blepharoplasties for well over 30, but with the laser for about 23 years. And so I used to actually make this initial outline incision with the laser. I quickly decided to stop doing that because the CO2 laser has heat. It generates heat. And when you make the incision with the laser, that heat translates into this incision staying pink twice as long as it normally would. So by making the incision just with a little fine blade, and let's have some buckets around. If we have extra buckets or anything. Yeah, or even non-red, it doesn't matter, just anything so I can throw off gauze. So by doing it with the blade here, that incision will heal up beautifully. And you can see I've already outlined the incision there. And Daniel, I'm going to go to your side now, so we're going to trade spots. So that's the reason. I mean, in theory, I could do this with the laser, but there's no big advantage. Maybe it'll save a minute or so, but the patients appreciate having an incision that fades much faster, as opposed to having that incision stay pink, you know, for a couple months. And you can see how well that numbing medicine works, because we have not had Daniel scream yet. And don't start now. That was a little joke, Dan. I mean, not Daniel. I'm sorry, Harry. My mistake. I'm thinking of Daniel, our videographer. That was Harry. Sorry, Harry.
That's okay.
Okay, so now we have. You can see both incisions have been outlined, and then we're going to put one last little round of numbing drops before we do the next step. So we're going to open your eyelids, and then we'll put in one more round of drops. Good. Bring your chin up. So next, of course, being an ophthalmologist, I'm highly sensitive to taking good care of the eyes. So we always protect the eyes. So I'm going to have Harry look down to his feet. Good. And I'm just going to slip in a little protective shield like that. And then in the eye that we're actually going to be starting the blepharoplasty, we have a different type of shield which serves two purposes. We'll have him look down again. And so this shield not only protects the eyes, but it also acts as an extra set of hands. I feel a little pressure here, possibly, Harry. It's like that. Are you okay?
Yep.
Perfect. So you can see that it keeps the eyelid exposed. And then now you're going to hear, and I apologize, I'll try and speak over it, but you're going to hear a little vacuum because the laser energy, that heat, generates what we call a plume, and that plume also has a little odor, and depending upon if you're a nice person or an evil person, that odor may be different, and that's just a joke. But we try and vacuum. He'll smell it, but believe me, he'll smell it a lot less with the vacuum than if we didn't have the vacuum. So you're going to hear vacuum in the background. This is not, you got to turn it down. Go to options. Turn it. Okay. So turn down one. That's the volume. Good, perfect. Okay, so we have the vacuum. Will we go to ready? And how's the view there, Daniel? Before I start, okay. Melissa, can you aim that light this way somehow? Dan, a little bit more light, maybe just a touch. You can see what a beautiful dissection there is with this laser. Very, very minimal bleeding. I mean, you might think there's a lot of bleeding. This is nothing. This is a few drops. So there's our skin removal. Wet one. Just have a bunch of wet ones out here. And you can see how pretty that looks. Certainly pretty for me. Now we're going to test to see if he has a little bit of fat. He doesn't. He has a little bit, not as much as some people. So we're going to take a look at. This is the easiest way to determine what kind of pizza the person ate the night before. And this looks like maybe it's nice and yellow, which is beautiful. So I suspect it was Hawaiian pizza. And you can you see that there? The nice fat. And then in the inner corners, there's usually some fat. And again, you can see the nice fat there. So am I right, Harry? Was it Hawaiian pizza?
Close.
Okay, well, I can't predict pizza, but I can predict the future. So what I'm predicting is that
Chinese
the women will be after you based upon your eyelids. Okay, so basically we'll be stitching at the end, but you can see how easy that was. And then now we're going to just switch the shields around. So we're going to take this shield out, put it over here. And now we're going to put the shield here. Now as I'm doing this every year, we've been doing these live surgeries for quite a number of years now, and I always like to take this opportunity to publicly proclaim my gratitude for our entire staff that is absolutely phenomenal, starting with our other doctors, Dr. Schifrin, who's been with us 3 years, Dr. Zambrano, who's joining us starting in March, our administrator, Mike, who just does an incredible job and is very dedicated, and of course to the entire team, front office, back office, nursing team, surgery team, optical team, marketing team, you name it. So without all of you, this couldn't be possible, so I want to give a shout out. So here we go again. You ready, Harry?
Yep.
All right, Harry's ready. So again, another beautiful dissection. It's nice to see that Harry isn't much of a bleeder. Is that light pointing in the right direction? Just double check. Okay. Dan, maybe a little bit more light, Dan. So on this side, when we do the right lid, it's a little bit different because we can then determine what Harry had for breakfast today. And clearly you can see that Harry had eggs and bacon, didn't you, Harry?
Yeah. Margarita.
You had a margarita for breakfast, Harry?
We weren't supposed to say that.
And there's some fat there, right? I don't know, it looks like eggs and bacon to me. And again, you can see here, see how that teases out very nicely, that little fat there. Again, a little fat there. Nice big piece of fat there. Anything else remaining here? A little bit here. So it looks like in Harry's case he has a little bit more fat on the right lid than on the left. And again, it's not unusual. Everyone's different. Okay. So there we have that again. Now we're going to take the shields out. And I always like to just squirt some vodka on this, you know, just for good measure. A little vodka, a little rum and coke. And so now we're on the home stretch. We're just going to put the little stitch in. And you still with us, Harry?
Uh-huh.
So Harry's still with us. And for those of you paying attention, he has not screamed yet. Okay, so I use what's called a 6-O-proline suture. You can see it's a royal blue color. It's very fine. It's a what's called a synthetic monofilament. So it's not a braided suture that causes an inflammatory reaction. Synthetic monofilaments don't elicit an inflammatory reaction. So it's basically one continuous weaving stitch. So we tie off one knot on one corner. Now, one of the questions that I get frequently is asking me whether I stitch this by hand. And one of these days I'm going to surprise the person by saying, no, I stitch it with my feet instead of by hand. But no, there's no little machine that does this. I just make sure and have enough beers before I start to make sure my hand is steady. And of course, for those of you who don't know me, I'm just teasing because I don't drink other than coffee and orange juice and water. So I hope everyone is enjoying this, and I hope everyone can see it, can hear me okay. We're having a grand time here. Harry has been an exceptional patient.
It's really easy.
Say it real loud, Harry.
It's really easy.
It's really easy, he says. Now, in those cases when we are doing the upper eyelids along with the lower eyelids, there is one main difference. In the lower eyelids, it does require more pushing and pulling and more stimulation. So the lower eyelids, 100% of the time, we do it with our anesthetist here, giving IV sedation, so the patient's out in la-la land. So if we're doing the upper lids at the same time, then the whole thing is under IV sedation. The upper lids, as you can see, it is pretty darn easy, so it's rare unless somebody asks, and occasionally we have maybe 1% of our patients that will ask us for a little twilight. And if they ask us in advance, we're happy to oblige. So you can see already how good that looks there. Perfect. So home stretch, Harry, one more lid.
Okay.
And again, a big shout out to our two medical students, Daniel and Annie, who are helping us out today as videographers extraordinaire. They're both fourth-year medical students here at Midwestern University in Glendale. And as I recall, I think, is it Daniel's going into internal medicine? Is that correct? Daniel, who's here with me, going into internal medicine, and I think Annie's, is she doing family practice?
Yes.
So Annie's doing family practice. But it's still not too late to see the light and do a little ophthalmology. And Melissa, have I missed anything? Can you think of anything, Melissa or Jan?
Do you want to talk about having them stop aspirin?
Oh yeah, okay. So Melissa brought up a good point. So we do recommend for patients, and we'll ask Harry in a second because I don't recall in his case, but we do recommend in an effort to try and minimize bruising, if a person is an aspirin taker, we like to stop aspirin at least a week before surgery if possible, preferably 2 weeks before. Also, supplements such as omega-3 fatty acid supplements, fish or krill oil supplements, or any extra vitamin E like Edward, we like to stop those as well. Other vitamins like general multivitamins or A, B, C, D, or calcium, those are all fine. CoQ10, that's fine. If you're on a prescription blood thinner, you know, Coumadin, warfarin, Plavix, clopidogrel, Xarelto, Eliquis, you know, you name it. Depending on the specific one, we'd like to have the patient stop it anywhere from 2 to 5 days before, depending on the specific blood thinner. So eyelid surgery is something that we don't want to do if their blood is fully thinned on a prescription blood thinner. Different than cataract surgery. Cataract surgery, when we do cataract surgery, we don't typically stop blood thinners for that. Oh yeah, okay, thank you. Yeah, Melissa's on it. She's reminding me of things to talk about. The upper lids, obviously depending upon the severity, as well as depending upon what your medical insurance is. In many cases, I mean, it's never 100%, but in many cases we are able to go through kind of a lengthy authorization process. It can take 3 or 4 weeks to get it authorized from your insurance. And in other cases, there are insurances that automatically exclude blepharoplasty, certain plans. So it's an excluded procedure. Or, you know, the bottom line is that it's just not bad enough. You know, then obviously we do what we call the self-pay or the non-insurance. And by the way, for those of you who think you may be in that category today, and it's only for today, we never, ever, ever, ever discount eyelid surgery, but we decided at the last minute to go ahead and offer a 20% discount if you prepay today for the upper lids. Obviously lower lids are never insurance related. A little more vodka, and we can take a look at both lids together. And then Daniel, do your best. I know your eyelids are going to feel heavy from the local anesthesia. Can you? God, I keep saying Daniel. Sorry. Okay, so look up towards me. So basically, there's Harry. He's looking up now. He doesn't have good control of his eyelids right now because of the local anesthetic. So that'll take a few hours for that to wear off. So everything's going to be heavy and sleepy and numb and blurry from the ointment that's in his eyes. And he's not going to be able to blink fully or close his eyes right now because the local anesthetic, you know, it's like going to the dentist and having your teeth injected and then trying to sip through a straw. It doesn't quite work. And then at the end, when we're done, take a little bit of ointment, and I just put a little bit of ointment along the incisions, and then this is what you'll be using at home for the first 10, 12 days or so. So there's a little bit of ointment. And Shazam! Harry, you did it!
I'm going to be able to see properly now.
Yeah. Not immediately, because you do have ointment in your eye, so it's going to make it blurry, okay?
Okay.
Okay, so Daniel will keep videoing. I'm going to get changed, and we're going to take Harry back to the recovery area, and then once he feels okay, which should be immediately, then I'm going to help walk him out to meet the crowd. Okay, fair enough?
Fair enough.
Okay, you were a real trooper. Great job.
Thank you.
Oh, sure. Okay. Hey, while we're waiting, Daniel, let's just do a quick tour of the surgery center for those of you who haven't taken a tour. So why don't you turn around, and this is the CO2 laser. So this is the machine. Let me bring it over here. This is the machine that I use for doing the blepharoplasty. Now when we're doing laser skin resurfacing, we have a different handpiece that doesn't make it cuts or incisions that we use for laser resurfacing. So that's the laser. And Daniel, why don't you come over this side where I am? And then we're going to go step by step. So basically over next to that, that's our general anesthesia equipment over there, the blue. If we go more to the right, that big heavy duty machine in the far corner is our what's called our LensX femtosecond laser that we use for cataract surgery. Over here in the middle where it says Centurion, that's our Infinity phacoemulsification system, which is also for cataract surgery. As we go to the right, you see a big microscope, operating microscope. Again, that's also used for cataract surgery. And then to the right there, just below, that's our vacuum that we used a moment ago that we were vacuuming during the eyelid surgery. And then finally over here to the right, this is called Aura. It's kind of hard to explain, but this is the best piece of equipment ever designed for cataract surgery. And it has a specific role in cataract surgery. So that's basically kind of do an overview of the surgery center there.
Bye-bye.
Bye.
All right, good job.
Good job.
Jan, is Jan?
Yeah.
Yeah, let's check his chart to see if we have the before photo that we can take out there.
Okay. I'm gonna take this side down, okay?
All right, you can just lay it on his lap there. Would you like something to drink? Would you like some water or juice or anything?
Apple juice, orange juice, water?
Yeah, I'll have some water.
All right. Excuse me, Daniel.
With this, catches every bad spot.
Good job.
If you can bring the legs down.
You betcha.
And how do you feel from a stability standpoint?
I think I feel, like I'm okay.
Okay. Well, just go slowly. You can take that with you if you like. I mean, if you don't want it, you don't have to drink it. Okay, you ready to go out? Okay, if you feel unsteady, just say the word and I'll catch you.
Okay.
All right, come on out. So we're coming out, everyone. Dun, dun, dun. Dun, 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 dun. All right, give Harry a hand. Yeah, he has ointment in his eyes. Hey, Beth, are there people on the other side too? Are there people on the other side? Yes. Okay, so for those of you on the other side, we'll be right over there, so we won't abandon you. So let's come on up here, that way everyone can hear. So come on through here, watch the bags, if you don't mind. Were you able to see everything? That's funny, you can see the delay because we're still in the recovery room. That's that stupid satellite. So come on over. Come on over and turn around. And now this was Daniel, his photo before, right? And already, even though his eyelids are puffy from the local anesthetic, but I mean it's already significantly better. And you saw that he didn't grimace or scream more than 10 times, and he had just minimal bleeding, right? I mean, hopefully you could appreciate that he hardly had any bleeding at all. And so you have that fine little stitch, which right now you're not really seeing the stitch. What you're seeing is the purple line when I was drawing on him. That's what you're seeing. You can't really see the stitch from your distance because it's very fine. So, I'm sorry. So that's, any questions for Harry before we go over to the other side?
Can we see the picture?
Oh yeah. Well, it's not the after, it's just the before. The after is here.
Can you close your eyes too?
He's not going to be able to now, because remember what I said? The local anesthetic, it's like going to the dentist. The local anesthetic inhibits, for the next few hours, his ability to squeeze, because his orbicularis muscle has been relaxed, right? So now's not the time to judge that.
Yeah, it's like going to the eye doctor for a checkup.
Like going to the eye doctor for a checkup. I like that. Here. Step away from the speaker there.
So will the sun bother you?
It's amazing. There's a little swelling. There was no pain at all. A little sting when I got, the numbness, the numb shot. Other than that, it feels a little swollen, and that's it. It's blurry. I can't focus real well.
And the reason it's blurry, let me just jump in. Again, the reason it's blurry is you saw me put in those shields, right? Well, those shields are lubricated, and we put, it's not Vaseline, but think of it, it's called Goniasol, it's hydroxymethylcellulose, you chemists out there. But think of it like putting Vaseline, so that the shields are comfortable, we lubricate them on the inside, and so when we take them out, all that gel and goop stays in his eyes for a couple of hours, and that's what gives the blur. It's not the surgery that gives the blur, it's that ointment.
If anybody is going to have it done, it's really just a breeze to go through. And I imagine for 2 days of little swelling and redness, it's going to be well worth it for me to be able to see regular again.
So let's walk over. So any other questions? Any other questions for Harry? We're going to walk over to the other side. Yes, over here.
I just wanted to know, is it self-dissolving or do you have
No, I don't use dissolvable. I mean, there are a minority of doctors out there that will use dissolvable sutures. For this, I do not. I'm not a fan of that because dissolvable sutures, two things. How do sutures dissolve? They dissolve through an inflammatory reaction. So you're actually creating more inflammation. And number two, you don't have control of how quickly they dissolve. And in some cases, you're increasing the likelihood that if they dissolve too quickly and if the tensile strength of the suture is not there, the wound might gape. So again, maybe 5% of surgeons might do that, but I'm in the 95% where we take them out next week. And it takes 2 seconds to take them out because it's one continuous stitch. So you cut the knots and you pull it out. It's very simple. Okay, so we're going to go to the other side, Harry. Dun, 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 dun. Oh, yeah.
She wanted to know about the recovery.
As far as what? It depends on how much bruising and swelling. I don't think she's going to have much bruising and swelling at all. And you can always tell. Some people do have more, but by the time they come in next week to take the stitches out, they're 90% or more, 95% on the road to recovery. All right, go tell them. Go tell them. Okay, let's make a quick stop to take a photo here in front of our banner here. Beth. All right. So here's Beth. And we'll hold this photo here. Hey, come on, Beth. Got it? Yes, okay. Let's keep walking over here. All right, we're coming your way. Wow, there's only a handful. Everyone already got up. We're coming back over here. Come on back. Come on back. Come on back.
Pardon? Oh, thank you. With the lashes up further, it makes it feel so much better already. But you're going to have some swelling, but other than that, it's...
It said affect your eyes. Sorry, I think they all mixed it.
Come out here in case if anyone wants to. All right, here's the Honorable Harry. And we'll turn around here. And so, do any of you have any questions for Harry?
It was really easy. I mean, a little sting from the shot to numb you, and that's it.
Could you feel that, like the plate, that metal plate, could you feel that going in?
The shield.
The shield?
You feel a little, but your eyes are numb, so you barely feel a little pressure.
Well, it's up to him. I mean, he can use the lowers, but that's a personal preference.
He just did my husband's Neil Wolf. He did that about a month ago.
All
Yeah,
right.
he loves it. Yeah.
And Beth?
He did the
Right,
lowers.
yeah, and he did the brows. He did the brows.
Right.
He did the brows.
How many, does your showering and everything?
He shower normally. We just don't want him rubbing the eyes, so when he comes out of the shower, just either gently, ever so gently pat dry, or just let it air dry. But we don't want any manipulation of
But
this.
let me tell you what I did. I put ice on my husband every so often, every day, every hour for 15 minutes. Because ice, that's what I did, and he just recovered so fast.
How many years?
Kudos to you.
How many years has it last?
How many years?
There's no exact number. It's a matter of how you continue to age. Right? And it also depends upon what age you have it done. Like for Harry, I can't imagine that he's going to ever need to have it done again.
I lived in sunny country for a long time and squinting. I'm sure had a lot.
Yeah, if he was 30 or 40 years of age, I would say, yeah, there's a very good likelihood that at some point when you get older, you're going to do it again. So I would say 10% of my blepharoplasties that I do every year are secondary blepharoplasties, people who already had them done 15, 20, 25 years ago.
Yeah, it was a great.
Yes, water soluble.
It was real surprised.
Go off the next day or two.
Can I ask how old you are, Harry?
I'm 71.
71 going on 50.
Trying to.
Yeah. All right. Thank you so very much. And let's come this way.
Thank you.
Thank you. Thank you.
A little blurry.
Yeah. Be careful. Careful if you need to grab on. You're welcome. Okay. Watch your step here. Hi. How are you? Excuse that. Excuse that.
Feel like you can see it.
What?
Feel like you can see it.
No.
Hey, Doc. You running this?
Some good stuff.
I picked up a couple. Perfect. Got another raffle to do last night.
They didn't call them out.
Yeah, they have.
Is this your significant other? Did you watch everything? Didn't gross you out or anything?
No.
Wonderful.
Good, thank you. It's a breeze too.
Yeah, we watched it, okay?
You
So this is a little something for you guys to spend an evening together. So take care of it. And when you're feeling better, enjoy it. Okay. So again, we want to thank you so very much. Appreciate you playing the game with us. And thank you for being married. Yeah, no, you're going to do great. Ari looks wonderful.
Can you close your eyes for me? Close your eyes.
He's not going to be able to close them now.
Won't be able to close them.
Not right now. He has
I'm all
local, I went
numb.
through this in the video. He has local anesthetic. It's like going to the dentist and having an injection and then sipping
Yeah,
through a
it's
straw.
going to be a couple hours.
A couple
before
hours
I
to have
get-
local anesthetic. You can see the local anesthetic. See the white where it blanches.
Oh, okay, I just thought that's where
That's
you
the
washed
local
it.
anesthetic. No, so he's not gonna. He doesn't have full control of his eyelids right now till that wears off.
So if you go home and sleep, you're not gonna,
It's only for a couple hours. His eyes are already lubricated with a bunch of
you're
ointment.
doing this for me in 2 weeks as well.
There you go. This is what it's gonna be like.
I'm thinking I want to close my eyes and go to sleep. And then I thought, I didn't ask him to
Do
close.
that. Do that.
Awesome. It looks awesome.
Thank you. Yeah, there's no pain except for it's a little puffy, and you know your eyes are, you can't close them yet for a couple hours. But other than that, it's a breeze.
Yeah. See, I wasn't here for the injection. Awesome. Did you take a Valium or something before?
Yeah, I took one.
I think it's more placebo than anything else. I think most people
Yeah.
don't really need a Valium, even though they do take it. But maybe give you a little relaxation.
I didn't want to take any chances.
I wouldn't
Give you
either.
extra. Give you extra.
Thank you. You just did my cataract, so I missed you. I'm sorry to
Thank you very much. Appreciate it. Thank you.